Thanks so much for the invite today, and it's a bit of a hard act to follow. So yes, so I lead on tobacco, vaping. I do add that one in now because that's a huge area. Gambling and diet and healthy weight policy. So this means that I look at the ways different aspects of society impact on the health of the population, as well as the disproportionate burden that can be experienced by those in more deprived communities. And gambling policy, unlike my other remits, is an area that's less well understood than the harms from, say, an unhealthy diet or from smoking. And this is not simply because it's harder to quantify the potential harms experienced from gambling, but also because, as already been mentioned, for many individuals experiencing the harm, it's a hidden condition. And also, unlike my other remits, there isn't a unified voice representing the third sector and the lived experience. This is something I hope we can change. And as I know, it can be really beneficial to that one voice to raise awareness, raise the issues, and actually to raise the issues with government. I know the work that's been going on with the NCD Alliance Scotland has shown that, the importance of that voice. And individuals experiencing gambling-related harm, like any other individual, will have other concerns and factors in their life which could impact on their decisions to gamble. Gambling doesn't happen in isolation. People are complex. The situations that they live in are complex. And then there's also the added burden of stigma, which exists for many individuals and means it can be even harder to reach out for help. And we need to make sure that people do reach out for help, for the support, but also to have the conversations. And this is where events like this is really important, to open up the conversations, to start the dialogue. But also to add to this is the complex legislative situation. Gambling is largely reserved through the Gambling Act, but aspects such as some areas of licensing and health are devolved. And this doesn't mean that we cannot take action, but unlike other areas that I lead on, it's an added complexity that we need to work through, and really welcome your voices here on how we can do that. And as mentioned, the launch of the white paper earlier in the year was wide-ranging, but possibly not as wide-ranging as it could have been. It covered 4 main areas: responding to the risks of online gambling, funding for gambling addiction treatment, strengthening the regulatory systems to work in consumers' interests, and modernising outdated regulations. And I know the online gambling is a real issue, but also when you're on your phone and the ads that pop up, having a kind of conversation with people around ads that people are seeing, and actually the avenue to raise concerns with the Advertising Standards Agency for them to look into, to investigate, to see if these people these agencies have actually broke the regulations, and actually to raise awareness that is one avenue to raise concerns. We could spend all day talking about the different components of the white paper, and I know there are a number of consultations ongoing at the moment, and I would urge you to look at those and see what they cover and if you would like to respond. However, the area of the white paper that's of most interest to me at the moment is the gambling levy, and that's probably of no surprise because of what we could possibly use. So the Gambling Act states it's for purposes related to or by providing financial assistance for projects related to, this is really hard, this is language, legislation language, so bear with me, addiction to gambling, other forms of harm or exploitation associated with gambling, or any of the licensing objectives. And I think for me the important point is for projects related to, how can we use that? And the levy consultation comes at a really important time in Scotland. Unlike other areas of the UK, we don't have a specific treatment centre, and we've much more work to do to understand the pathways for people to find support, for information, and to support that meets their needs. The funds that could come through from a levy, and this is really important that people respond to the levy to say how important it is, could be used to develop support systems, both around prevention and treatment in Scotland. The consultation asks about how the levy will be designed, including proposals on the total amount to be raised and how it will be managed. There are 3 broad areas: structure, distribution and governance. And if you'd let me, I'd like to quickly touch on these in turn because I think it's really important. So in structure, reviews how the levy would work both for online operators and for land-based operators. And for me, I kind of reflect on what it was like when I was 16 or 17 and going to put on the bet for my granddad on a Saturday morning, and going up to the local shop after he'd looked at the Daily Record and picked up all these horses through the magazine, and actually going into a smoke-filled room as a 16 or 17-year-old to put that on for my granddad really left an impression on me. But actually for me, thinking about that, the smoke-filled room, we've changed that. Things can change and we need to work together to think about how we can change. If you think about the distribution of what the levy consultation talks about, is how funding could be allocated across research, improving our data. That is one of the big key problems we have, is to understand the prevalence, understand the scale, because for that we can then use that as a case to say why we need to have action. For prevention, to inform. Ailey's already spoke a lot about how to speak to your children and have those conversations. I have a 14-year-old. I know that kind of conversation. I talk about the ticker tape that goes behind his eyes when I try to tell him something. And I know when he's got the ticker tape and he's not paying attention. But actually, how do we have those productive conversations? And for treatment, how do we support those who need help in a way that meets their needs? But also governance, how to ensure transparency and accountability. But it's critical that the distribution and allocation of a levy takes account of the different landscapes across the UK. And we're working with the UK government and the other devolved administrations to talk through these issues. But the levy must meet the needs of Scotland, informed by the context of Scotland, and be distributed by experts within Scotland. And that's a really key point that we're pushing on. And also really want to touch on the work that we're doing within Scottish Government and with Public Health Scotland, and that's a gambling related harms working group, and that's specifically come together to look to see what can we do now, what can we do while the white paper is out to consultation, but also discussing how funding could be used in Scotland and how can we ensure good governance and accountability in the work that we're doing, and link across the wide-ranging excellent work that's ongoing in Scotland, that actually we just need to bring people together to make these links. Many of the room will know about this work and know much more than myself, and have views on how we can take this forward. And we cannot work in isolation. And it's important to hear the views of those with lived experience and their wider networks. I'm here today primarily to listen, to hear your views and to discuss opportunities to progress both prevention and treatment. We have a real opportunity to work together collaboratively to support change and to improve our systems. And I look forward to hearing from you through the rest of the day and ongoing beyond this event, and for the panel session in the afternoon. So just thank you very much for allowing me to speak.